in terms of how I use my catering expertise and background in terms of informing my public health, what I do now, I think there's three things that I would say about what I take from the catering industry into my public health role as a public health nutritionist. One, that's where I discovered nutrition, was through going to catering college, and so that was a big driver for me to then go on to study undergrad and postgraduate level nutrition and human nutrition. So catering was a driving force behind me doing what I'm doing now. And in terms of just informing me about food and cooking and preparation, those are skills and knowledge that I bring to bear even today in my work to try and tackle obesity. Just that knowledge of food and being able to apply it to different scenarios and different programs is always there. So whether it's about working in the Food Standards Agency on a program to help children cook, eat safe, healthy food, obviously cooking skills was massively important. So it was great for me to be able to then try to take some of my learning as a catering student into that practice. But I think the other thing between catering and public health nutrition is that they share very similar themes in terms of, they're all about the end product and that end product working to, from a catering perspective, please the customer, but also in terms of public health nutrition working in government, you want to change behaviours. And there's a recipe of ingredients that have all got to come together. You've got to use the right methods and approaches. And, sometimes you have to learn from your mistakes. And then you recreate programs and it's all evolving and learning. And so, those types of disciplines that I take from the catering industry still apply today. And teamwork. Teamwork in the catering industry is vital. And in what I do now, my team is the most important thing for me when I go to work and what we deliver. So there's lots of things that I take from that experience. My move from learning about being a chef and catering industry to what I'm doing now in terms of helping Public Health England to tackle obesity, particularly child obesity, that's been a long, about 15 years from catering college to what I'm doing now. And along the way, I've picked up lots of scientific skills and knowledge around food and nutrition and human nutrition, and put that into practice throughout my career as a civil servant and a public health nutritionist, trying to do something to change population behaviour around poor diets. And now, importantly, in my current role around tackling obesity and leading the Obesity and Healthy Weight team in Public Health England, then it is really fundamental about utilising what we know about energy intake and its impact on weight gain. And then, but also in the mix, it's about physical activity and sedentary lifestyles. Translating the evidence base and what we know about what people are eating and lifestyle behaviour is fundamental in informing the programmes of work that I'm aiming to deliver in Public Health England to prevent and tackle obesity. And also in my previous roles in the Food Standards Agency. So I'll probably use two examples to highlight how I believe we've helped to translate the evidence base into something practical. And so back in the Food Standards Agency, we commissioned the National Children's Bureau to undertake a Healthy Challenge programme in schools in Kent. And this was quite a simple programme about giving children and schools the opportunity to take challenge and pledge to commit to change something around healthy eating, getting active and feeling good. And that had really promising results. And at the time, I was involved with the London Organising Committee of the Olympic Games and their Healthy Active Lifestyles part of their Get Set education programme. And they were looking for a programme to herald and lead that bit of work. And so I worked with them and with organisations such as the Youth Sport Trust, the Department of Health, the School Food Trust, to bring that programme, that research, into reality. And so a programme that was informed by young people actually became a reality, and we rolled it out through a universal website that schools could access, where they could look at what other kids were doing around these challenges. They could develop challenges themselves, and importantly, we also worked with charitable organisations to target a broader spectrum of kids, so they could also partake in what was an inspirational lead up to London 2012. And it was successful. By October 2011, over 3,000 individual challenges were being taken on the website, and so that was a really useful example of taking something that was commissioned as a peer research program and taking it much wider into an accessible program for schools. The other piece of work that I'll reflect on a little bit about taking the evidence base and putting it into practice was a bit of work that we supported the Men's Health Forum to disseminate. They were involved as a dissemination partner with the Universities of Aberdeen, Stirling and Bournemouth, who had undertaken a whole series of systematic reviews about what works for men and weight management. This is a massive issue. Of course, mainly men tend to not get that engaged with the mainstream weight management programs. And this was an important systematic review, which was a National Institute of Health research program that was published. And the Men's Health Forum's role was to then translate that into practical advice. And I was talking to them about other pieces of work. They told me about this, and it just made common sense for Public Health England to support them to disseminate it. And that's exactly what we did. And they published a nice little handbook that we sent out to practitioners on how to develop and deliver an effective weight management service for men. Subsequently, we're supporting the Men's Health Forum to work with a small number of local authorities and their programs to put that guidance into practice. And so those pilots are underway, and I'm really excited to see what the benefits they bring, because I think, getting more men to think about their weight and their dietary behaviour and how active they are and how much they're drinking is really important. And we know that when men engage with those weight management programs, they do really well. And so it's really about positioning them so they can feel more involved. That doesn't mean to say that they need to be segregated from, their partners and women taking part in weight management. But it's just about thinking it through about what works for individuals. And so that's a really important piece of work.